Welcome, everyone. I am Leanne Jones. We are here for the Society of Thoracic Surgeons Congenital Heart Surgery Database User Group call for Tuesday, June the 1st. I hope you all had a nice, relaxing weekend and were able to get some time to unwind, relax, spend some time with your family. Again, thank you to everyone whose family has family members that have served and paid the ultimate sacrifice. So again, thank you everyone for that. All right, so let's go ahead and get started. Our agenda for today, our welcome and introductions. I'll provide our STS update, then we'll turn things over to IQVIA, and then we'll end up, per usual, with our user feedback. On the call with me today from the STS, we have myself and Carol Crone. We have Addie Dolan. We also have, who else do we have from the STS? Well, Emily Conrad, sorry, Emily. We have Dr. Meyer on with us from our surgeon leadership, and we have Chastity Wilnitz on and Janet Kreutzer from our core group perspective, and Leslie Wacker as well. From the IQVIA side, we have our usual suspects. We have Melanie, Jean, Michelle, and actually today we have Jeffrey joining us. Joe is out on vacation this week, so Jeffrey is going to be providing an update on the IQVIA side for us today. Let's go ahead and get started. For our STS updates, as everyone is aware from our last call, the 2020 harvest analysis is still on track. That data is expected to be released to you all this summer. Dashboards will be beta tested prior to release, so we will be reaching out to our beta testers prior to the release of these reports to conduct our beta testing. And also just know that once all of this data is available for you all, you will be notified when that data is available within the IQVIA platform. Our 2021 harvest update, obviously no changes here. The spring 2021 harvest close date is still to be determined per the task force, and as well as everything that we've heard from our data managers. We are waiting to set that harvest close date until you all have the opportunity to review that 2020 analysis. So again, we will be reviewing that harvest close date once the data is released this summer. You all have had ample time to review, and we've gotten feedback from you all. Again, as we stated before, obviously you guys are aware we will give ample time for you all to continue to clean up any data after reviewing and get that data resubmitted. Just a reminder to, please continue to take opportunity of the open submission and cleaning your data. And also that 2021, this current spring harvest includes data up through 12/31/2020. Our 2021 audit update, as you're aware, selected sites were notified by the STS on May the 11th. CRS has provided audit deadlines, so I just wanted to share those these deadlines for those sites that were selected. The deadline today is the last day for your audit date selection, so you should select your date with CRS by today, and the OR case log is to be uploaded by today. Our next audit deadline is July 1, the upload deadline. You should have your random case records uploaded, your mortality case records uploaded, as well as that linking file. If you have any questions regarding the audit, please reach out to CRS directly, and they can assist you with any of your questions that you have pertaining to this year's audit. I also wanted to give a quick update for our data version 6.22, our next data version. As you all are aware, we have completed the standard upgrade process for the next version. Originally, the go live date was scheduled for January 1st of 2022. However, that go live date has been pushed back to July 1st. Of 2022. Just a quick little background. In regards to the naming convention for the 6.22, I know this has tripped up a couple of people, and I just wanted to clarify, as you're aware, currently our current data version is 3.41. In the past, we really didn't have a naming convention for our versions, a proper naming convention that we followed, but since moving to IQVIA, we've adopted a naming convention that we can continue to use moving forward. All of our congenital data versions, we'll start with the number 6, and the 0.22 afterwards reflects to the year that version is going live. So our next version upgrade for data for congenital would be 6.25. So our next upgrade would be in 25. Oh my gosh, it's 25, yes. So confusing. But again, just wanted to give a little bit of background if you have questions of why we're moving from 3.41 to 6.22. Again, we've just adopted that new naming convention for the upgrades moving forward. I also wanted to point out the biggest thing that the biggest factor for delaying this go live is due to the incorporation of the adults with congenital heart disease component. This is a new component that we are incorporating into the congenital database. If you attended AQO last year, you should remember Dr. Jennifer Nelson and Dr. Frank Scholl have been leading this initiative, and Dr. Nelson did give a presentation last year at AQO, and there will be additional information this year at AQO about incorporating these adult variables into the congenital database. Again, this new component will be for patients 18 and over only. And again, we'll be adding select variables from the adult cardiac database into this new congenital version. This is a lot of work. We've been working very closely with surgeon leaders as well as your vendors on how these variables will be incorporated and how this is going to work. But again, we just wanted to make sure that we took our time with incorporating this component, make sure we get it right. We also need to provide a great deal of data manager education. So with that, we will be hosting upgrade webinars. Our first set of data manager education and upgrade webinars are scheduled to begin the 1st of September. We'll have these upgrade webinars weekly. The upgrade webinars and the data manager education will include a walkthrough of these new 6.22 data collection form. We'll literally walk through every single variable. Specifically, we need to spend a great deal of time on educating the adult cardiac variables that are being added. I know many of you don't have the experience or haven't had the opportunity to collect those adult variables, so there is going to be a quite good amount of education that is going to be provided on how to collect these adult cardiac variables for those patients 18 and over. And our fearless leader, Carol Crone, I think will be handling that education. So we look forward to Carol providing that education for us. If you are not able to make some of these upgrade webinars, each of those webinars will be recorded and posted out on the STS webinars page. So just know if you cannot make it, those webinars will be recorded and you can always go back and revisit those webinars. Also, with the new 6.22 upgrade, we will be working on a new and improved training manual. This new improved training manual will be a lot better organized, be more user-friendly. If you all have any ideas on improvements that you would like to see, also we will be providing surgeon worksheets for the new upgrade. So again, if you have ideas on training manual improvements, surgeon worksheets, things you would like to see in those surgeon worksheets, please feel free to email me at ljones@sts with any of your ideas. We'll definitely share those with the core group and members that will be working on that new training manual. It's going to be a lot of work, but we understand that the current format of the training manual is not very user-friendly. So we will be working very hard to get that improved and better organized for you. Let's see, next, I just wanted to give a quick update on our AQO meeting. Again, the AQO this year is scheduled for October 12th to the 15th. Our congenital session day will be Friday, October the 15th. Abstraction, we are now accepting abstracts for AQO. Just a friendly reminder that deadline is coming up very soon. The deadline for your abstract submissions is Friday, June 18th. At 11:59 p.m. Eastern time. So please be sure to get those abstracts in. We look forward to having the congenital abstracts this year. If you have any questions, again, just reach out to us. And again, I've provided a link to the abstract submission website, as well as for those of you who may be submitting an abstract for the first time, we do encourage you to review the April 20th webinar that was presented. Patty Toyer gave an excellent presentation on creating an abstract. So if you're new to this and you would just like a little review, again, we really do encourage you to go out to our webinars page and review that April 20th webinar and that session that Patty gave on creating your abstract. Also, all of you are aware we have free registration for our data managers. In order to be eligible for that free registration, you must be listed as a contact on your site's participation agreement. If you're not sure if you are listed as a contact or if your coworker is not listed as a contact, your data manager, please email us at stsdb@sts.org. If you need to add a data manager to your participation agreement, your primary data and file contact must be the one to submit to get them added. Again, we must verify all of those contacts that are added to your participation agreement. So again, if you need to get added to your site's participation agreement, that participant contact form must be submitted by your primary data and file contact if you are not indeed the primary data and file contact for your site. Also, there's a list of the database participant and platform roles out on the STS website. Again, just review that document for more information on which role you should be assigned within the IQVIA platform. Also, we have one more planning committee meeting for AQO. We had a meeting, I believe it was last month. We had a great session. We have lots of good topics planned for you guys. If you would like to provide any suggestions for this year's meeting, please feel free to email those to me at ljones@sts.org. Again, if you could get those into me as soon as possible. Again, we do have another call scheduled this week. So not this week, I'm sorry, I apologize, this month. So if you could get any of those suggestions to me sooner rather than later, so we can talk about those on our next meeting, we can try and get those incorporated. Let's see. Also, one very important thing I wanted to shout out, the STS Education Department has released the STS Cardiothoracic Surgery ebook. This thing is absolutely amazing. I'm kind of obsessed with it. Carol laughs at me about it, but I'm really obsessed with this. So I just wanted to share a quick blurb from the Education Department. So the STS Cardiothoracic Surgery ebook is the most complete and authoritative online resource of cardiothoracic surgical information in the world. It provides a rich multimedia educational experience that includes regularly updated content in cardiac surgery, adult and pediatric cardiac, and general thoracic surgery, a total of over 350 plus chapters. The ebook includes over 780 hand-drawn, high-quality medical illustrations, includes over 25,000 evidence-based references, plus photographs, tables, and relevant surgical videos. It's accessible 24/7. There's an app for it. Of course, there's an app for everything. So I do encourage you all to reach out or to learn more, go to sts.org/ebook. There are individual prices there's prices for members and non-members, and there's also the option for institutional pricing. So again, we do encourage you to check this out. It's a phenomenal resource, and again, I'm slightly obsessed with it. So be sure and check that out. That is all that I have from the STS side of things. I'm going to turn things over to Jeffrey for our IQVIA update. Jeffrey? Yep. Jeffrey, are you on mute?
I was, yes, thank you. All right, good day, everyone. So I was going to go through our IQVIA update. The first thing I wanted to cover was the releases that were released by the development team in May and just now in June. Both of these revolve around the uploader. STS 6239 primary procedure mismatch report was not reflecting changes submitted via the uploader. People were uploading, changes as far as what was the primary procedure to the system, and unfortunately those changes were not being reflected in the mismatch report. STS 6322, new variables began appearing for certain sites on the missing variable report, which had not previously been present. This too, I believe this was just resolved with the most recent release. However, both of these issues, to see the changes on the end user side, they would need to re-upload the impacted cases. And this actually dovetails into the important request that is highlighted at the bottom. IQVIA development reset the checksum on all CHSD sites just this past month, and are requesting users to resubmit their data sets to the IQVIA platform to refresh all the data for the last 4 years. We stress that you resubmit your files by individual years and not for the entire 4-year time frame. All right, next slide. The items on this slide, we've got a release timing for July 2021, and they both concern the primary procedure report, STS 6325. Primary procedure mismatch report exclusion rule number 1 was being ignored for certain cases in place of the general rule, or in certain cases, it was ignoring report exception rule 1 and just going by the general rule when it should have been following exception rule 1. STS 6337, primary procedure report was not correctly applying exception rule 2 for all cases, especially ones who had a combination code selected. Again, these two we're foreseeing to be resolved with a release scheduled for July. Next slide. Items on this are to be determined when the release will be, but they all focus on the missing variable report. STS 6211, the missing variable report, had an issue with the Pro Complex Con 4, and for the uninitiated, that short name refers to the prothrombin complex concentrate dose 3. That variable was appearing as missing, but should not be appearing as missing in the MVR. STS 6343, the unknown option should be considered as missing for the mortality status at database discharge, or short name MTDB disstat, on the missing variable report, but when unknown was chosen, it was not showing as missing on the report, or is not showing as missing. The next item, STS 6427, the missing variable report is flagging the on-demand version element as missing even for migrated records. And of course, if they were migrated, on-demand version would not be applicable. Finally, STS 6340, we received a request to remove the MT365 stat variable from the mortality filter and remove the number 2 in brackets in the name column for the short name MT365 stat in the MVR. Again, these will be addressed in a release that as of the moment is TBD, or to be determined. Please note any submitted tickets are currently under review, and the IQVIA support team will follow up on resolution and/or target release confirmation. The IQVIA team is currently reviewing the items and will be released in an upcoming release. Those items will be posted in addition in the notification section on the platform.
Okay. Thank you so much, Jeffrey. I appreciate it.
Thank you.
All right, for going to wrap up with our standard slides, which you all are familiar with. Support plan. Again, just our plea to please include that participant ID number in your communications with STS and IQVIA. We have our support number here, as well as the support email. List of resources available to you out on the STS website. Also, again, just a link to our STS National Database feedback form. Please feel free to use that form to provide any feedback to us, good or bad. Also, list of resource documents available to you out on the STS website. As always, my contact information, please feel free to reach out to me directly. My email address is ljones@sts.org. Phone numbers listed here. This is my direct line. If you have any database operational questions, please feel free to reach out to us at stsdb@sts.org. And for the database operational questions, these include questions regarding to your participation agreement, who are your current contacts listed on your agreement, let's see, participation agreement, contacts, access to the IQVIA platform, surgeon access to the IQVIA platform. Again, just please reach out to us at stsdb@sts.org. When you are contacting us about access to the platform, if you have multiple sites, please be sure to indicate which participant ID and which site. That is extremely helpful. And if you're asking if your surgeons have access, if you could please specify which surgeons you are asking, which surgeon you're referring to, which surgeons need access, which surgeons currently have access. Again, just if you could please be more specific with us. I know sometimes we get the emails, do my surgeons have access? And we have no idea which surgeon. So again, please reach out to us at stsdb@sts.org. Mark your calendars accordingly. Our upcoming webinars for our next monthly webinar is scheduled for June 15th at 12 p.m. Central Time, and our next user group call is scheduled for June 29th at 12 p.m. Central Time. So again, mark your calendars for our webinars, additional webinars this month. They'll be coming up before you know it. Busy month. So with that, I'm going to turn things over to you all. If you have questions, again, please feel free to submit your questions via the Q&A. If you have, we also have the raise hand function available. If you all have questions, please feel free to utilize that raise hand function. We'll unmute you. Just make sure that your microphone is enabled. Let's see here. Let's get to our first question. Yes, ma'am.
This is Melanie. I just wanted to one quick thing that I needed to just call out in regards to what's coming with IQVIA also, that we are putting together the full known issues list and also the list of enhancements that are being reviewed by the STS and IQVIA teams, so that you have transparency to see, of course, current known issues. I know we cover the known issues that are specific, of course, within each one of these sessions that we have, but just a comprehensive list so that if you want to be able, we've gotten that request before, we want to make sure that you're able to review that. So later on this week, because the team is still working on just putting all of that together. So again, known issues and also the enhancements that are coming to the platform so that you have that transparency. Okay, so just wanted to throw that out there.
Oh, thanks, Mel. All right, let's get to our questions. Let's see, from Maggie, will surgeon worksheets be related to the new adult congenital cardiac sequences or to pediatric sequences? Any idea on how many sequences will be added or how many variables? So surgeon worksheets, we would ideally, obviously, we would like to have them for both. So if you have ideas for the pediatric side, we have ideas for surgeon worksheets for the adult cardiac side, please share. Let us know. We definitely would like to get surgeon worksheets added for both. Any idea on how many of these sequences will be added? I don't have that number off the top of my head. I know Carol may be able to share some of the specific sections that are being added. She knows that information a lot better, some more detail than I do. Carol, can you highlight a few of the sections that are going to be added from, or key variables that are coming over from the adult cardiac side?
Yeah. Hi, Leanne. Thanks. So I think this is a great question, Maggie. I just want to also answer on the surgeon worksheets. We will have them for both the new adult and the pediatric sections. The adult sections will probably be stealing what we developed for the adult cardiac surgeon worksheets and modifying it to fit into the congenital side a little bit better for those sections. And it is going to be a major change to the congenital data collection form. I don't know the number of fields off of the top of my head, but it is quite a few. And we will be, and I don't want to freak anybody out or cause unnecessary anxiety over this. We will provide a lot of education and support for the upgrade, and we'll be going over that at a high level. We could do that, the high level, maybe on the monthly webinar, either this month or next month if we have time. And then we'll be doing a deep dive into the upgrade using a draft DCF starting in September. And those will be weekly webinars on the Tuesdays, except for the week of Thanksgiving and Christmas. September 7th will be our first one, and we'll of course notify sites of all that. It is going to be a big change. We are working closely with the vendors and the surgeons and the core group to make sure we implement these changes correctly to avoid double capture and things like that. So we'll let you keep you all updated and provide you a lot more information as we get closer to that. I'm still working on building out the data collection form. And that's going to take a little bit of time. So when we have something more substantial, we'll let you all know, but it is in the process, and we will provide a lot of education and a lot of resources to help you all have the tools to do your job.
Yeah, I guess
Yeah, and
maybe
go
I
ahead.
could just add, you know, the additional fields which are designed to sort of collect pretty similar information, whether you're ultimately coming through the STS adult database or the congenital database, but the extra things that would be collected through the congenital database will only appear if you're doing this all electronically for a patient who's over 18. Otherwise, you would see the congenital data collection form all by itself without the extra information or extra fields. So at least that's the way I think it's planned for this point.
Yeah.
And
Yeah, that is correct.
Great
right,
point.
and there's going to be a fair amount of, you know, parent-child relationships for the fields. And so I think all of that said, you know, I hope everybody would be moving towards an electronic data entry as opposed to doing it on paper, because it's really going to be, you know, you're going to have a lot of pages when you consider all the drop downs and all the other things that are there for, you know, for information to be entered. So I think, and you know, this is a not exactly computer savvy guy talking, but you know, I think it's clearly the way to go if I could make that recommendation to everybody.
Excellent. Thank you, Dr.
I see another question kind of related, Leanne, and if you don't mind if I share my screen real fast regarding what's a surgeon worksheet.
Yep. Here, I'm going to stop share and you should be good to go.
All right, 1 second. So surgeon worksheets are forms that we develop. They're kind of a template, and sites are able to, we post them in Word. So sites are able to download these and customize them for your surgeons. And you might even have to customize them specific to each surgeon at your facility, depending on what kind of feedback you get and what kind of information. You know, some surgeons provide some information, others provide others. So you might be able to customize these to each surgeon. They're intended to capture things that are that the surgeon experiences in the OR. So it would probably be more operative in nature. And there might be some other questions when we get into the aorta section. You'll see some questions that are often missed in their dictations that would be included on these forms. They can be scanned into the medical record, as long as I would say that the surgeon probably should sign it so they can become part of the medical record. But essentially, we post them both in PDF and Word, and you can manipulate these as you want. But I'll just show you the cabbage worksheet. It's based off of the data collection form, and we just kind of simplify it so it's not as much information as you would find on the data collection form, but it's things that the surgeon typically would dictate in their notes, and this sometimes they might miss something, or this can even help them with their dictation. So it's kind of a snapshot of things that they did in the OR. The cabbage one is very straightforward. We're just asking about operative information in the cabbage. When we get to the aorta section, you'll see we have different ones for, open dissection, open aneurysm, endo, dissections and aneurysms, and then others. So if I open this one, let's see if that will go. This gets a little bit more complicated, but the surgeon is expected to fill these out. So it's really important that you work with your heart team at your hospital when we introduce these, educate the OR staff, because they're going to be your biggest help in, they're going to be your biggest help in getting the surgeons into this routine of filling it out. And it's going to ask things that the surgeon would know. And sometimes the surgeons don't dictate everything in their consults, but these are things that are going to help complete the data collection form and get you good, clean data. So we get it, it just has information, some of the genetic information, and then procedural information. This is pre-procedural, and then we get into the operative information. And these, again, as I said, this is a lot of information, and sometimes the surgeons, they use canned operative or canned consult notes in the EHRs that may not cover all of these. So no, and there's another question, are you going to have this for every type of surgery? No, but you can certainly make them at your facility if you wanted. When I was abstracting, we made our own surgeon worksheets according to the procedures that were mostly done at our facilities. And we used those with the surgeons and worked with our OR nurses to get buy-in from the surgeons and make sure that this was on, a clipboard for the surgeon before he left the operating room as they're getting the patient off the table or whatever it is, where they can just easily go through and check information off. And I made these for when I was at the facility, just for myself. And I know we had these here at STS before, but they were very simple. So for aorta, we've added quite a few in for this version, and then we have them each for the valves, and we have an intraoperative TEE worksheet that the anesthesiologist can fill out. So we anticipate that we'll be able to provide these. They may not be available right at go live because we have quite a bit of steps to take to get through between now and then. So we'll do our best to have what we can available, and it might be more generic, but as I said, go in and we paste them in Word version. We usually do not paste Word version at STS, but we paste them in Word version so that they can be edited at your site for your surgeons and your heart team. So that's what the surgeon worksheets are. I'm going to stop.
Awesome. Great. Oh, You're fine. I was curious if anybody like Chastity or Janet or Leslie, anybody from the core group side, do you guys use these? I don't know if or anything like that currently at your facilities, or do you just use the data collection form as is?
This is Janet. We don't do anything on paper at all at this point.
Okay.
Correct. This is Chastity. Same thing.
Yeah. Okay.
And you can build these. One of the things is that you can build these into the EHRs. So you can work with your IT team to build these forms into the EHR. And some sites have been doing that. So just an idea for when we do go live, or even now, if you want it to work with your IT teams to start building forms, you can certainly do that.
Hey, it's Leslie. So for our adult team, we weren't able to get them in the EHR because it was just such a long process. So if anyone is thinking they might want to do that, definitely reach out sooner than later to your IT teams and figure out what the process is. What we did for congenital and adult at U of M is we created a separate database for the surgeons to enter bits of information into that we think would be best coming from them. The adult team then adapted those worksheets and put some of that information in their online portal. And for congenital, we just have sort of some basic highlights for the surgeon to specifically note, so that in case it's not in the op note or it's not detailed enough, that kind of thing. So
that's great. Thanks, Leslie. That's a good point. Yeah, it takes time to get on IT schedule, doesn't it?
Yeah, it was like 18 to 24 months for us to be able to implement that. So by that time, they would have a new version, or at least be working on one.
Yeah, right.
Leslie, Maggie had a follow-up question for you. She says, what type of information did you find needed to be added?
Was that for me? I missed it.
Yeah, Leslie, she wanted to ask you, what type of information did you find needed to be added?
Oh, I got you. So for congenital, we don't have a ton of extra things. We just wanted to make sure that specifically in an STS code, we got the procedure and diagnosis directly from the surgeon, and then our team reviews it and goes back and forth if we think there might be something that's better. We also then programmed it so anytime they enter a procedure that could have procedure specific factors, even if it's not primary, it prompts them to answer all of those questions. And I think that's the most helpful for us. So I don't have to go digging in so many different places for all of that data.
Gotcha. Nice.
We've tried to
All right.
incorporate some of the procedure specific factors, and that has been helpful. Because again, otherwise you're going back and forth, like Leslie said, to a bunch of different places to elicit some of that information. Now, whether the surgeons choose to include it or not is a different story, but we've at least attempted to put that and some of the pre-op factors in their electronic templates.
Leslie, you have another follow-up question from Diane. Is your diagnosis and procedure dumped electronically directly from EMR to STS?
No. So this is a totally separate database because we found some challenges. If you're entering in the front end of your software, you get all that front end validation. And so we just, as a program, have decided not to automatically upload data directly into the software any longer. So just on the back end, then I can check it and then manually enter it right now.
Great, and we don't allow for automatic abstraction.
Right.
Except for some fields.
I was ready to
Just to clarify.
Yeah, well, and everybody should understand, of course, what goes into the EMR. You know, if you're using, as most hospitals do, is ICD-10, that's not nearly granular enough to yield the information we need for, you know, for the STS congenital database. And, you know, obviously it's all about who put the data in and how accurate they are. And it's our general sense that the data managers do a whole lot better job about this than you know, certainly your coders in your institution, who are, it's about, you know, getting the maximum reimbursement and not necessarily about, you know, giving us the data the way us who have designed these data collection forms and everything, you know, had in mind. So I would caution about using anything that you get from the electronic medical record unless it's at least physician or expert clinician, you know, derived. I mean, you know, we've studied this, the you know, the discrepancies between the hospital coding and the STS coding are quite significant. Which of course is why we don't think that all this data that comes through that way, you know, from the hospitals, you know, how they're collecting information for billing purposes, you know, it really is quite discrepant from when a head-to-head comparison has actually been done. And I think Sarah Pasquale is the first author on the paper, if anybody's interested in looking it up.
Okay. Thank you, Dr. Meyer. Let's see. We have a question, AQO. I think Emily's still on the call. Emily, do we have a guesstimate on when we're going to open up AQO registration?
Yes, it will be mid-July. So around July 20th is our goal. We will be sure to add information to STS National Database News. We'll probably also send an email out separately to all of our database managers, and we'll put something on that AQO website that I put in the chat. So be on the lookout mid-July.
Great, thanks. That's my birthday. It's a great birthday present for me. AQO
There you go.
Yeah. I celebrate my birthday and sign up for AQO. Oh, Kelly, I think Kelly had her hand raised, so let me unmute. Kelly, I think you're good. You should be able to to ask your question.
Yes. So I have a question about Jeffrey's slide about resubmitting all of the 4 years of data. So if we've not previously submitted 4 years of data, do we need to go back now and submit 4 years of data?
This is Melanie. Sorry,
Melanie?
I was on mute.
That's
Just
all right.
clicking away. Hi, Kelly. Okay, so you have not submitted the last 4 years. That's what you're indicating. You haven't submitted anything via the uploader the last 4 years. Just want to confirm that that's what I'm understanding.
I have not submitted historical data that did not need to be changed.
Okay.
Not submitted data that's already at DCRI that required no changes.
Then there is nothing for you in regards to, if there's nothing that you have not submitted. So if there's no changes and you've never submitted anything via the uploader that would have changes, you would not have to. So I would recommend, if you've done anything for 2020, 2019, have you done anything for the, okay, so the active time period for when you've uploaded, so that we make sure that anything that you've submitted and potentially have updated afterwards, to make sure that we have the most current updated information. So 2020, if you've done that, 2019, if you've even done anything in 2018, you could go ahead and resubmit. But if you have not done anything in 2018, for example, then there's no need for you to do that.
So for example, if I had submitted a random case in 2018 that required, I don't know, for an admission date or a discharge date, then I would have to resubmit that. Is that what you're saying?
Yes, resubmit that. And if you know the time frame where that case fell, you don't have to do the entire 2018 year. But again, if you know for a fact in that instance it was 1 or 2 cases and you know that time period, then resubmit for that time period.
And can you explain to me again why we have to do this?
So there was a change on the uploader with so currently when you do, or previous to the change, there was a checksum functionality, which basically says that if there were no identified changes, it would just pass that case along. It would not flag it. And so you would see on the DQR where it would give you a message where it would say, the record was not updated, right? Like a record was already in the database. I can't remember the specific message on the DQR, but basically it's saying that there were no changes to that record, so it's not processing any changes. And so we reset the checksum to allow and to verify that if there are any changes, and there were specific fields, and I don't know if you have the slide that you can bring up, Leanne. On that slide that Jeffrey had spoke to, there were specific fields.
You're not sharing your screen yet.
And then we can.
Yeah, there it is.
Here we go. So yes, on that slide. Yeah, thank you. On that slide, there were identified fields that were coming up on the NBR that were not present before. These fields were not being updated, and they should have in certain instances. So those specific fields are the ones that called into play where the checksum had to be reset. And so the checksum being reset will allow you to resubmit your records, and it will make sure to capture any changes that were done and make sure that all of those are applied for those fields within the database. So it's basically just the reset of the checksum. Basically, you'll see on your uploader history card, previously it would probably say 1 of 1, right? And maybe you had potentially 10 records that were sitting in there. Now that the checksum is reset, you will see that it will reprocess all of the records in the file. So instead of it saying 1 of 1, it potentially will say 10 of 10. So you will see that when you do another upload. So that's what happened over the weekend, where the reset of the checksum basically just opens up and it allows all of the records that are being submitted to basically refresh all of the records that are included in that submission.
Okay, so let me make sure that I understand this right. And maybe I'm not understanding this. So in our previous harvest submission, if we made changes to historical records, we submitted those changes. Were those uploaded and sent to
Those were processed, yes, and sent to DCRI, correct.
So at what point did this, because I made changes in the last harvest. I've not made any changes in my 2017 and 18 data since the last harvest.
So the change came into play within the April timeframe. So this was after the harvest had closed. So everything processed, everything updated at that time, but there was an update that was required after the fact.
Okay, so
And so
April.
Yes.
Okay, all right.
So now we're asking, because of this change within the uploader, and to, of course, be prepared, getting prepared for when the next harvest is going to be set. Right now, harvest date is not set, it's TBD. We want to make sure that we have all refreshed information, just in case if there were changes, and to make sure that we have everything up to date. So we opened it up by resetting that checksum and basically just notifying when you, and it's already in effect. I think someone had asked the question of when they could start. You could start today. It's already available. And so you could do that, you could start that process. You don't have to, again, we're not asking for you to do the entire 4-year time frame. We're asking if you can just split that up and submit again at your, when you're able to do so.
Okay, all right. All right, that helps clear that up.
Okay.
And then I have one more question, Melanie.
Yeah.
About the donor procurements that
Yes.
Yes.
Did I thought that they either Joe or another team member was going to reach out. So that donor procurement is specific to the dashboard report. Is that correct? It's not the MBR or primary procedure. Were you referring to the dashboard?
I will have to double check and see. It seems
Okay.
like it hit more than one area in the platform.
So I had a email that, because we were trying to find the ticket and there was no specific ticket, but there was an item where you had referenced the index operation, that it was displaying organ procurements on the dashboard report. But if there's more areas that you're referring to, if you can confirm.
Yeah, and I can send you all those ticket numbers. They're from the last harvest.
Right. And
This
we
is
were
the
looking
last
through
one, right?
those. We were looking through those, and the one specific item was related to the dashboard.
Okay.
And so that is on our list for the dashboard updates that we'll be doing.
Okay.
And so that is, again, we wanted to make sure that we have some more transparency in regards to what's coming, right? The enhancements, of course, the known issues. So we will be posting within the library, and this will probably towards the end of this week, where we will have information available. And that is one of the items. But if there, and that was specific to the dashboard, but if you're saying that you saw other areas for organ procurements impact, where you're seeing that, then please let me know.
Will do. Okay. Thank you.
Oh, thank you, Kelly.
Melanie, just another question regarding the resubmission from Heather.
Yeah.
She's like, how will we verify what actually gets updated if the uploader tells us that 100% of the records are updated?
So let me see. How do we know? I'm trying to think. There were specific instances for sites, and I'm wondering if I can get, I think the best way is maybe I work with the dev team to give the actual impact, if there were at specific sites, impacted records, for us to be able to provide that. But when they made the change for the reset of the checksum, they didn't do it for specific sites. The reset of the checksum happened for all sites. So the main thing that the user community will be seeing is that they will see that the record count on the uploader history card, it's no longer going to be, if it's maybe 10 records, you're going to see all of the records processed. It will be 10 out of 10. Whereas before, if there were records that were already in the database, it would show maybe 1 out of 1, right? It would update 1 record out of 1. With this reset of the checksum, the change in behavior, just so that everyone is aware that when you do submit the actual cases, you will see that it's going to process all of the records. So we didn't want to alarm anyone to say, hey, something, you know, it went wrong. That is expected functionality, where they would see all records being processed at this time. But again, what we can do is just work and see if we can provide, and I'll work with the dev team to see if we can provide, if there are specific instances where they will see the before and after, the list of actual cases. We'll see if we can do that and then submit that to sites so that they can have for reference.
Okay, great. Thank you, Melanie.
Mhm.
Let's see, our next question from Michelle. We're in the process of changing software vendors. I've already submitted 4 years of data via IQVIA using the old software vendor. Do I need to resubmit the data using the new vendor? I have not been able to get the old vendor to submit a letter about the vendor change. Please advise.
Okay, we may need to get her information to just make
Okay.
sure, and we probably need to loop in the
Or
dev
what-
team also.
Okay.
So if we can, and I'm not sure who the question came from, but if they
Michelle
haven't
Edwards.
submitted a ticket, Michelle Edward. Okay, okay, I can see it now. Michelle, if you can just contact our support team, please, and we can go ahead and just make sure that everything is coordinated and your transition is smooth. We just want to make sure. The thing is, we've had instances where in previous transitions where patient IDs were not transferred correctly, patients were given new patient IDs. So technically, those are 2 different patients. I think that we, again, need to just make sure we step through this process to make sure that we don't have duplication, for example, that the original patient is being transferred correctly. So we just do need to make sure that we do that due diligence to verify all of that information. So reach out to our support team, and then we can get others involved to work with you.
Thank you, Melanie. All right, I don't see any additional questions. I know we're coming up on the hour. I don't know if anyone from the STS side or Dr. Meyer, anybody have anything else they'd like to add before we close for the day? Not seeing anything. As always, if you need to reach out to me, please feel free to email me directly, ljones@sts.org. Happy to chat about any questions or concerns. So with that, I'm not seeing any additional questions. Thank you everyone for joining. Just a friendly reminder to mark your calendars. Our next call is scheduled for June 15th at 12 p.m. Central. And then our next user group call is scheduled for June 29th at 12 p.m. Central. So thank you everyone for joining today. I hope you guys all have a nice remainder of the week, and have a great day. Have a great afternoon. Thank you, everyone. Thanks, everyone from the STS and IQVIA side, core group, and Dr. Meyer. Thank you so much for joining today. I appreciate all of your help.
Thanks, Leanne. Great job. Great job,
Thank you.
everybody. Thank you.
Thank you.
Thank you. Good
Thank you, everyone.